Hi everyone, welcome to our lecture on quality improvement as well as patient safety and nurse leadership. I want to talk a little bit about where the importance of patient safety came from. And so healthcare error was brought to the forefront through two key reports. The first one was a landmark US report called To Err is Human, and a Canadian study called the Adverse Events Study brought to light that despite improvements in understanding, measurement, and practice, there continues to be limited improvement in patient safety. The latest document is called Safer Healthcare Now, and it's available at this website. And so it's very important to reduce and mitigate unsafe acts within the healthcare system because we want to ensure that our patients have the best optimal patient outcomes. But healthcare systems are finding that they have increased capacity pressures on themselves, and higher demands have been placed on nurses, mean that these errors do happen, and it is critical for organizations and healthcare providers to focus on ways that they can advance quality care and prevent errors. And so this is where this whole understanding of safety first came from, in that healthcare organizations and healthcare providers need to strive to provide high quality, safe, efficient, and cost-effective care. And sometimes those are hard, looking at safe, efficient, but also cost-effective. Also fundamental to these efforts is a deep understanding and commitment to the concepts of quality, safety, and risk in organizations. And this is where we get into the concept of quality management. And quality management in healthcare is all about having a focus on improvement in patient care, patient safety, and resource use. So let's look at some quality management principles. The first one is that quality management operates most effectively within a flat, democratic organizational structure. And I've given you an example here of a tall organization where things need to filter down from the top, whereas a more flat organization, you can see how the communications patterns could be better, and that maybe individuals, leaders, managers, and workers could be more committed to quality improvement. And a third principle is that the goal of quality management is to improve systems and processes and not to assign blame. And so if there's an area within a healthcare system that is not doing well, it's not to assign blame, it's to figure out why that area is having higher rates of poor patient outcomes. Lastly, it's important for patients to define quality, so looking to your patient satisfaction rates, and that quality improvement focuses on the outcomes, and that decisions need to be based on data. So what are the goals of quality improvement? Well, obviously to improve the healthcare system, not to assign blame, to educate all employees about quality improvement strategies. There needs to be a free flow of communication, and the use of patient safety indicators is used to shift the focus of error analysis. So kind of focusing again from that blame, that error, more to what can we do to make sure that the patient safety indicators have been met. So we're shifting the focus from kind of patient safety from error analysis. So what are some of the benefits of quality management? Well, you have greater efficiency and proactive planning. It increases in patient safety with quality care, and it also enhances your job satisfaction. If you're working in an institution that has great quality management and reduction in error, and you want to promote the best for your patient, it's going to enhance your job satisfaction. So, what are the roles of nurses in quality and safety? Well, nurses have a unique role in patient safety and quality improvement because they deliver the direct care to patients, and they have an understanding of the day-to-day issues involved in the delivery of care. And that's why I always encourage students to get involved in any quality improvement initiatives in the area that you're working in. So let's look at the role of nurses in quality and safety a little bit more specifically. So the engagement of nurses in patient safety and patient care improvement efforts can be found in a number of areas. Nurses can identify patient flow problems, safe delivery of care during periods of low staffing or high patient census or high acuity. So the ability to identify maybe some areas that can be worked on in situations where there is low staffing and high acuity, communication problems associated with complex patients, and medication safety. And so the engagement of nurses in these areas not only promotes the quality and safety of patient care, but creates a work environment, a positive work environment for staff. And so these are the areas that really nurses can become involved in on the units they work in to improve quality and safety. In fact, nurses' perception of having access to empowering structures in their workplace is positively associated with nurse-assessed quality of care, patient safety climate, and work and unit effectiveness. And so the results of this work call upon nurse leaders to enable empowering work environments for all staff. Because if you allow your staff to be involved in improving the quality and safety in their unit, you're going to have a lot more empowerment. So what do we look at with respect to quality and safety in healthcare? Well, the Canadian Patient Safety Institute was founded to provide a coordinating and a leadership role across healthcare sectors. And they promote leading practices and they raise awareness to patients and the general public about patient safety. It's a non-for-profit organization and it works with governments, health organizations, healthcare leaders, and healthcare providers to inspire people to improve patient safety and quality by developing evidence-informed resources and working to deliver these measurable results. And so the Canadian Patient Safety Institute has developed competencies. And so these are competence that work environments and teams can look to for providing patient safety. And so they identified these 6 domains of safety competencies that enhance or influence patient safety. The first one is contributing to a patient safety culture. The second is for people working in healthcare to work in teams for patient safety, communicate effectively for patient safety, manage safety risks, optimize human and environmental factors, and recognize, responding to, and disclosing adverse events. And so if you want to have an organization that's in tune to having great quality and safety in their healthcare environment, this is what you need to focus on for individuals working in those teams. So again, an emphasis on safety first. Although the safety competencies relate to individual practitioners in the environment, key organizational factors are also of huge importance to advance the safety agenda. One area that has emerged is the focus on high reliability organizations. And there are 5 principles to high reliability organizations. So the first one is preoccupation with failure. So that's the transparency. And so this is the first principle, and it relates to the relentless focus of organizations on safety concerns in the work environment. And so members of interprofessional teams and other team members are encouraged to identify any safety concerns as they may be part of a larger issue in the system or a gap in information or knowledge that may not be evident. And so it's very important to be transparent. The second principle is reluctance to simplify, and that's improvement models. And it focuses on the need for staff to look beyond the obvious and avoid jumping to potential quick fix solutions. Asking questions about what is happening and potential drivers can help teams understand the issue more deeply, identify the root cause, and implement more effective solutions. Sensitivity to operations or continuous learning is the third principle, and it outlines the importance of situational awareness related to how systems and processes are working within the organization so that potential risks to safety can be identified and actioned. Team members need to speak up for safety when they see an error or identify an issue or process that may affect safety for patients and staff. The fourth principle, commitment to resiliency or accountability, focuses on the ability of individuals and teams to address problems, implement solutions, and bounce back from errors. Learning from errors and focusing on implementing change helps staff and organizations build knowledge, become learning organizations, and move forward to advance their safety agenda. The fifth and final principle of high reliability organizations is deference to expertise. Those who have the most knowledge about the situation are encouraged to speak up, voice concerns, and share ideas. The concept of hierarchy needs to be considered in that those who are delivering care or a service in an organization would be the experts in that area and could best identify gaps and opportunities. Hello, nurses at the bedside. In high reliability organizations, all team members play an important role in patient and staff safety. So we know healthcare organizations are complex and dynamic, and the implementation of high reliability principles can enhance quality and safety outcomes and reduce risk for patients and staff. Implementing these high reliability organizational principles has been found to improve nursing sensitive outcomes. And nursing sensitive outcomes are measured by reductions in such things as central line infections, catheter associated urinary tract infections, falls, and pressure injuries. Hospital acquired conditions, like what was just described, can have a substantial cost to the patient and healthcare system from a morbidity and mortality perspective, increased length of stay and costs of care, as well as reputational risks, so negative public image, employee frustration, and employee turnover. So it's important to look at these specific safety issues and nursing sensitive outcomes. A framework has been established by on HRO principles to build organizational capacity on their journey to having high reliability and understanding that it is a journey and not a destination. Steps to high reliability include having an organizational-wide approach to managing risk through a relentless focus on safety. So safety first. Tools have been deployed in HROs, and they include some things that you may have seen already. Standardized checklists, for example, the pre-op checklist day of surgery. So this is a way to ensure safety and to prevent errors. Evidence-based practice bundles. And so having evidence-based RNAO has a lot of evidence-based practices, and incorporating those RNAO evidence-based practices into your clinical work. And a lot of hospitals are incorporating all those RNAO best practice guidelines. Encouraging near miss reporting. So this is really important, is that reporting a near miss, because a near miss can mean an incident in the future. So reporting those near miss is really important. Having daily safety huddles is also been one that I've been involved in on the unit to ensure that the unit and safety concerns are coming forward in a timely manner. And also important is a requirement for a standardized patient safety curriculum. And this is something at Southlake that all individuals who work at Southlake have to redo your curriculum every year on patient safety. So it's really important for all staff to understand their role in patient safety. Another piece is communication. Communication or lack of communication does lead to a lot of poor patient outcomes. And so use of tools to communicate clearly and effectively when concerns or risks are identified is really important, and you are familiar with SBAR. And also fundamental to the shift to a high reliability organization is transformational leadership, which you will remember. Because transformational leadership is a dual going between the leaders and the followers, and it supports the commitment to a cultural shift and becoming a no-blame learning healthcare organization. So all team members can lead change or lead for change in HROs and must understand their role in quality and patient safety. That it's not only the leader's role, but it's also the followers' role themselves. And so if followers are actively involved in improving quality and patient safety, there's a clear delineation in roles, and a safety culture will be supported. So if everyone's involved, everyone knows their roles, you're going to have an organization that has great safety. So if we look at patient safety cultural elements, that's how I left off on, and the importance of transformational leadership. You need to have a leadership commitment to safety, organizational resources for patient safety, so having those resources and tools available for staff, a priority of safety over production, meaning you need to think about cost. Safety over cost is very important. Effectiveness is important, to be always looking back to see if what you're doing is becoming effective or is effective. An openness of communication, transparency about problems and errors, continuous organizational learning, and frequency of unsafe acts. So looking at and following individuals that let's look at hand washing. Maybe there's an increase in poor hand washing on a unit. So looking at, is there areas in a hospital setting that have some unsafe acts? Or is there an increase of falls on a specific unit? So documenting those and figuring out why those are happening. So if we look at quality improvement on its own, it is looked at in a certain way. So in healthcare organizations, the approach to high reliability processes can involve looking at structure, process, and outcome elements. So the structure is things like the adequacy of the staffing, the effectiveness of computerized charting, availability of unit-based medication delivery systems, maybe to prevent more errors. Process is looking at the timeliness and thoroughness of documentation, adherence to critical pathways or care maps, and outcomes can be patient falls, hospital-acquired infection rates, medication errors, patient safety. And so when you look at quality improvement, you're looking at all these elements. Something that you may be familiar with is accreditation, and all hospitals go through accreditation. And in Canada, the implementation of the accreditation process for healthcare organizations was a major influence on the evolution of quality processes. Accreditation Canada has standard structured processes and outcomes, and they are assessed in all organizations. As part of its transformation, Accreditation Canada strengthened patient and family engagement in program design and services, as well as added patient surveyors to the survey team. So now when the accreditors come into the hospital, they not only speak to the people that work there, but they also speak to patients. And the steps taken by Accreditation Canada reflect the continued evolution of the organization to advance the focus of safety, quality, and continuous improvement. And these are some of the Accreditation Canada patient safety goals, looking at culture, communication, medication use, work-life, workforce, infection control, and risk assessment. Also, our all provincial and territorial professional associations, so for us it would be the College of Nurses, have been instrumental in the focus on quality processes in nursing by developing guidelines for implementing quality improvement programs. They have, for us, the College of Nurses has a quality assurance program, which you need to be part of every year. And it involves 3 components: self-assessment, practice assessment, and peer assessment. And you can go to CNO's website and look to these. And so it looks to ensuring that our nurses are safe to practice, that they are aware of the nursing practice standards and guidelines, and it also provides resources and tools for nurses to develop quality improvement competencies. And then if we look a little bit broader, our public healthcare system, so Health Quality Ontario, looks at or tabulates or collects public reporting of patient safety metrics. And that's changing the way that the public makes decisions about healthcare, and its intention is to improve care through easily accessible information. And so, for example, Health Quality Ontario reports to the public on quality metrics across all health sectors. And topics include patient safety and quality indicators such as hospital-associated infections, hand hygiene compliance, and hospital mortality rates. The public, so you're reporting out to the public here, So hospitals report to Health Quality Ontario, and Health Quality Ontario sends it out to the public, and the public can access a searchable database and yearly reports on Ontario's healthcare system at the organization's website, as well as they can view a section on QI in healthcare delivery and is designed to assist the public to become informed users of Ontario's healthcare system. So you can actually go in and see what the statistics are with respect to health quality, health safety. So what about patients? Patients' experience within healthcare can be assessed through the use of surveys, interviews, focus group discussions, or observation. Patients' perspective should be a key component of any QI, quality improvement initiative. However, patients cannot always adequately assess the competence of clinical performance, and therefore patient feedback and patient experience surveys must serve as only one data source for QI initiatives. But it's very important to get feedback from patients when you're doing any quality improvement initiative. And then I just want to focus lastly on risk management. You may often hear about risk management in your organization or on the unit that you're working in as a student. And so quality, safety, and risk management are related concepts and emphasize the achievement of quality outcome standards and the prevention of patient care problems. And so risk management is all about identifying, analyzing, and addressing potential or actual risks that may cause injury or losses. Losses are associated with risks include financial loss as a result of malpractice, maybe the cost of an extended length of stay for a client, negative public relations, employee dissatisfaction, but also risk management has a lot to do with patient safety and poor patient outcomes. And so just something to think about when you think about quality safety. Oftentimes you will hear risk management, and every organization will have a risk management team or a risk management officer or a manager. So I'm going to stop here, and in lesson 11.2, we're going to take the theory that we've learned about the quality improvement process and actually put it to work in a real life situation. So stay tuned for lesson 11.2.